So we've got two special guests on the line. I'm going to hand it over to Anna Maria to kick us off, but we also have our audiologist, Dr. Jessica Peterson, on the line as well, who will give us some really knowledgeable information a bit later in our session. So Anna Maria, I'll hand it over to you.
All right. Just to introduce myself a little, I'm a retired school teacher, and thank goodness for the Alzheimer's Association. I was so lost. I was dabbling in all sorts of, volunteer things, and nothing was quite hitting the spot. And the Alzheimer's Association really did it for me. I feel welcome. I feel productive. This is important work that I'm doing as a community educator, and I'm so excited about that. I lost both of my parents to Alzheimer's, and it's pretty devastating. So today's presentation on the 10 warning signs of Alzheimer's is really helpful, because in some ways I wish I had known some of these things when I was dealing with this 25 years ago or more. So, save your questions. If you think you might forget them, put them in the chat box, or we can talk about it afterwards. And by the way, I do love to see your faces. So unless there's going to be somebody dancing in the background or something, you're welcome to leave your faces on, so I don't feel like just this talking head out there. So yeah, no problems with that. All right, let's see if I've got the technology down. I'm going to try to share my screen. Let's get started. All right. All right, and sometimes what the goal today is, we want to kind of compare what's typical age-related memory loss or memory issues with what was not typical. A lot of times people say, hey, it's just it's a normal part of aging, but really Alzheimer's and dementia is not a normal part of aging. So we're going to look at that. We're going to compare some of the differences, and we're going to look at some of the common warning signs. And we're going to talk about tips. How do you approach someone who does have some memory concerns? It's kind of a delicate conversation to have. So we're going to go over some guidelines for that. And why get early detection? There is no cure. And so you may be asking yourself, what's the point of early detection? But there really are some important reasons why we should get early detection as soon as possible, the better. And what kind of tests are these? What's a diagnostic process? And then, of course, the resources that Alzheimer's Association can provide you. So let's take a look at the Garcias. The Garcias are a fictional family, but they really represent a very, hundreds of thousands of families across the United States that are dealing with this. Maybe some of you have dealt with this. I know that I have. It's very frightening. The beginning of it is like, oh my gosh, what am I going to do? And so the Garcias kind of represent a typical family. The doctors, however, that are going to be talking today are not fictional. They are real doctors. So let's go ahead and meet the Garcias. Mary's a 73-year-old widow. She lives alone. She's a retired school teacher. She's always been meticulous about taking care of things. One of her daughters lives close to her, so she can keep an eye on her, and she sees what's going on, and she's seeing the changes. The other daughter lives in another state, and that's pretty common of many families. All right. So, worried about mom. She keeps losing things, and the house is a mess. Probably a normal thing as we get older. It's so unlike her, though. Should we worry? Let's reach out to Dr. Salloway, because he's a neighbor, lucky for them. And Dr. Salloway is a leading expert in Alzheimer's.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
I think the beginning is always very difficult because we don't know, is this real? Is this happening? And there's a little bit of denial as well. We don't want to think that this is happening. So let's look at the 10 signs. Before we get started with those, what is dementia? It's one of the most frequent questions that I get asked. Well, what's the difference between dementia and Alzheimer's? So let's take a look at the experts.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
My mother had frontal temporal lobe dementia. My father had vascular dementia. Their issues were very different, and they had the dementia at the same time. My mother, fortunately, was able to live with me. My father lived in Mexico, and I had him in a wonderful facility, but their behaviors were completely different because they had a different type of dementia. It's kind of like saying someone has cancer, which type of cancer? And that's the overarching term is the word dementia. And what about Alzheimer's? What is that?
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
My mother experienced difficulty with swallowing, didn't know how to do it, it seems. So very, very sad. And why is it important to know the signs?
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
Unfortunately, it's not easy to diagnose initially. It took me 2 years to get the correct diagnosis for my mother. And I know I'm not alone. I've spoken to other people that have that same concern. They take their mother to the doctor, their father to the doctor, or their husband or wife, and no, everything's fine. They are able to pass these little simple tests. And it's difficult sometimes to get that proper diagnosis. I definitely had to be a squeaky wheel to finally find out that my mother had Pick's disease. That was exactly what she had. And as it progressed, sure enough, that her behavior matched the description of the disease. So don't give up. Sometimes you'll take your loved one to the doctor and they say, oh, He's just fine. He's great. And you'll know otherwise. So you have to be persistent, and you have to advocate for your loved ones. Okay, so now let's jump right into the 10 warning signs. By the way, this is not all of them. These are just the more common ones. My mother lost her sense of smell probably about 40 years ago. Now doctors know that if someone has, and not because of COVID, if someone has lost their sense of smell, that it may be an early warning sign of dementia. She lost her sense of smell when she was in her 50s. And sure enough, by the time she was in her 60s, she had dementia. So this is not all of them, but it's the major ones. All right, let's look at memory loss and how it disrupts life. Throughout all of this, what I'd really like to bring attention to is changes. All of this is, what are you observing? Is it different from what it used to be? Is it different in terms of memory, in terms of behavior, in terms of personality? Is that person changing somehow? That's the key word throughout this. So is it disrupting normal life? Are people forgetting important dates and events that they wouldn't have done in the past? Are they asking the same questions over and over and over? Oh, my dear daddy, he would ask again and again. But you have to be kind of relaxed about it. Yes, papi, Emma's taking me to the airport tomorrow. And isn't she wonderful? Oh, yeah. Literally, maybe not even a minute later, he would ask the same. How are you getting to the airport tomorrow, mija? Oh, Emma's going to say, oh, and it would be the same and the same. And you just have to be really relaxed about it and just love them. All you can do is love them. You can't change. You just asked me that. You can't get mad at them. You just have to accept the changes. And they may be relying on memory aids a little more than they used to. At a certain point, they don't even remember how to use the memory aids. So that's the thing. What's typical? Forgetting names. Heck, I've never been good with names. So I'm not going to get all scared and worried because I'm forgetting something. You might even forget an appointment. It happens. But if it's consistent, that's when it's really becoming a problem. Number 2, changes in planning or problem solving. You're going to see things where if someone has made banana nut bread all their lives and all of a sudden they're really having trouble. They've never had to have a recipe because they've made that recipe for 30 years. They know how to make banana nut bread. All of a sudden, they don't know what goes in next. That's kind of a clue. That's a warning sign. And difficulty concentrating, taking much longer to complete tasks. We're going to hear from John, and he describes it very well.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, that was in my sleep. I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of. So I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
I think about people that are retired and starting to experience dementia. Imagine still having to work and having dementia and noticing it at work, and trying to put all that energy into not letting people see that there's a problem. That just talk about compounding the stress, right? All right, number 3, difficulty completing familiar tasks. Doing something you've never done before, that's a separate thing. My father, I went to visit him after he hit his head. That's how he got the vascular dementia. He probably had a concussion, didn't go to the doctor. He changed and he was never the same again. I went to visit him after this, and we went to a grocery store in his neighborhood. He'd been living there for 10 years. On the way home, couldn't find the way home. And I couldn't help because I would get lost. It's a big city. He lived in Puebla. Then I really panicked. I thought, okay, this is it. He could not find it. We had to stop a taxi and get directions. Can't figure out what to buy at the grocery store. Oh, don't even know. Open the refrigerator and still don't know. Everybody has different things that they might be, but it's familiar tasks that are no longer familiar. They don't know what to do with familiar tasks. What's typical? To me, I do this, I do these presentations, but I don't do them every day. So every time I do it, it's like, okay, let's see, what buttons am I supposed to push? Having difficulty with technology, phones, they do funny things. That's normal. It's just those usual things that people have done forever that are now causing trouble. You know what? Let me go back to this one. I wanted to share this video. Let's hear from the expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
All right. Number 4, confusion with time or place. Having trouble understanding that something is not happening immediately. Something's a wedding event that's going to be happening in the future. And it's a difficult thing to grasp, but it's not happening now. It's going to happen in the future. Forgetting where they are or how they got there. Let's go home. They often want to go home. Typical is being confused about the day of the week. If any of you are retired out there, right, that happens because, yeah, there's not much difference between a Monday and a Thursday in my life, unless I have something going on, or a Saturday for that matter. So that's normal. That's nothing to be excited about. But if someone doesn't know that it's winter or spring or April, then it's a little bit different. Number 5, trouble understanding visual images. That's kind of interesting, and spatial perceptions. And that affects balance. People have difficulty reading because their vision is affected. Contrasts. What's typical? Cataracts, floaters. I got those too. That affects my vision, but I know it's not dementia. It's just these little rascals that are floating around in my eyeballs. So let's hear from the expert.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing. And in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Yeah, it's in the brain. Scary. All right. Number 6, new problems with words in speaking or writing. My mother had what's called expressive aphasia. She couldn't complete sentences. In the beginning, we thought it was because she just lost her husband. Eventually, she was not able to speak at all. Functional in every other way. She still drove. She was still very functional. No ability to speak. Then things progressed and the dementia got it was dramatic. But in the beginning, for the first 5 years, it was just in the speaking. That was all. We're going to listen to Phil, and you can see as he's struggling to even have this conversation.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
You feel for the guy. What's typical? Sometimes finding the right word. I know that I'm retired 4 years now. So there are certain words I used to use in school, in teaching. I don't use those words that myself, like, oh, what was that word? That's kind of normal. If you don't use it, you lose it, but it's different from having dementia. Number 6, misplacing things and losing the ability to retrace your steps. That's the real thing. You know, I might come home, go for a walk, I have my phone in my jacket, I hang up my jacket, a little while later, I go, oh gosh, where's my phone? I can go backwards and say, oh yeah, that's right, I went for a walk, I put it in there. So that's somebody with dementia doesn't have that ability to do that. Another thing is stealing. A lot of times they think somebody stole their things, and that's a very, very common warning sign. My aunt, she's 98 years old, bless her heart. She lives in a home. I went to visit her the other day, and she only had one earring on. I said, Tia, ¿qué te pasó? Where's that other earring? And she said, somebody stole it. She was convinced that somebody stole it. Then later on, my cousin said, yeah, the other day she couldn't find her dentures. She said someone stole her dentures. So it's a real common, when they don't find things, the answer in their minds is somebody stole them. Let's hear, now, what's normal? Misplacing things. But let's hear from the expert.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
A little bit of paranoia sets in. All right, next is decreased or poor judgment. This one is really scary. This is why so many elder people are scammed. My father was being robbed blind by his neighbors. He thought they were just wonderful. And we know that they were taking his Social Security payments for 2 years until I got him into a safe facility. He had no money. He would get his Social Security check the first of the month, and literally 4 and 5 days later, he had no money. Mija, you have to send me money. I have no money. No. And we knew as these ladies were taking him to the ATM and they were robbing him blind. So it's just one of those things. There's poor judgment in dealing with money. They also lose the ability to groom themselves. My dad would eat, he would get stuff on his shirt and then he would put that same shirt on the next day. Always was, dressed great. So these are the changes. Again, what we're seeing is changes. What's typical? We may make a mistake now and then, forget to change the oil in the car, but let's listen to the expert. Oh no, this is Teresa. She experienced this. She has dementia.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet rat, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
And again, it's the change in that person's behavior. If somebody was always a pack rat or always had a cluttered house, then that's not a warning sign. But if somebody was always pretty clean and meticulous and organized and all of a sudden their house is a mess, that's a sign. All right, number 9. withdrawal from work or social activities, just kind of losing interest, having trouble keeping up with, sports. If somebody was a Lakers fan and now they're having trouble, they don't even know when the games are on. And there's something that they used to enjoy to do. What's typical? Sometimes just as you get older, you go like, I don't feel like going to that social engagement. I don't feel like going there. That's a different thing. All right, let's hear from the expert.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And the problem with that is that withdrawing, isolation actually makes things worse. It's really important to stay social and stay connected. And this is what happens often. All right, last sign that we're going to talk about, doesn't mean that there aren't more, is changes in mood and personality. A lot of times people think, well, they can still remember things, but their personality has changed. Oh, that must not have anything to do with dementia. Well, it certainly can. So becoming confused, suspicious, depressed, fearful, anxious, those are things that may be attributable to dementia, or somebody may be experiencing depression and it may not have anything to do with dementia. So this is where it's really important to get professional help, to talk to a doctor to find out. Sometimes people are just easily upset. They lash out when they didn't used to be that way. What is typical age-related change? Kind of just liking things the way you have it and kind of being a little irritated when things are disrupted. All right, let's listen to the expert.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
All right. So let's check in with the Garcias and let's see what's going on with them. Because deciding what to do after you find out, that's a tough one. Do you look at the warning signs info I sent you? I did, but I still don't know. Mom's showing a couple of signs, but not all of them. Not all of the time. How do we know if it's serious enough to see a doctor? If you have questions, when in doubt, see a doctor. All right, let's see what Dr. Salloway has to say.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people, but they don't have to check off all the boxes.
I think the problem with this is that people are frightened And it's easy to want to deny that it's happening. So if someone is really doesn't have all these symptoms and maybe just has one or two, and then some days are great and then other days no, it's really easy to say, oh no, mom doesn't have any problems. She was great yesterday. She did everything right yesterday, or you didn't have any problems. So it's real easy to sort of say, no, it's not happening, and feed that bias. That's what you want. And so denial is a real common problem. All right, let's go. Let's see. So the importance of early detection, we're going to get to a little bit. A lot of times people say, what's the point? There's no cure. Why bother? But it's very important to get this information. So let's hear from the expert. What's
You know, it's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
all right? Let's take a look at what do you do if you're noticing changes? And so this is, just a little bit of a template of things. First, you have to assess the situation. Is this really happening? Is this what's really going on? If once you determine that, yes, it looks like there is, then this conversation has to be had. This is the second part of this little track here. Finally, once that conversation and everybody's on the same page, then it's time to reach out to the doctor. So what changes in memory and thinking and behavior do you see? Maybe write them down. What are you seeing here? What else is going on? Because a lot of times it could be something else. My mother-in-law, the other day, we thought she was having a stroke, and she was losing her words. She was almost hallucinating, very, very scary. Took her to emergency. Turns out she had a urinary tract infection that was so severe that it was affecting, the toxins were in her bloodstream and it was affecting her brain. So when I got home, I actually did the research because I thought urinary tract infection could make somebody act like that. Sure enough, it is something. So is there something else going on? Has the prescription medicine changed, or do they need to be on something? Is the diabetes stable? So what else is going on? And, of course, you've done this already. You're here, you're learning about the benefits of understanding and then early diagnosis. Has anyone else noticed the changes? Talk to family and friends and see what they have to say. Have the conversation. Boy, this has got to be handled just the right way. And pick the right time, the right place. Who should have that conversation? Maybe if you live with that person, maybe somebody else should have that conversation. Maybe a couple of you. Don't want to have people think that they're being ganged up on, but you have to really think about who is the best person in the family or loved one to have this discussion with them. Then what's the best time and place? Don't just have it when you're going to the grocery store shopping. Hey, Mom, I've been noticing you've been kind of forgetting things. You got to really plan this. This is a very, very delicate conversation. What will the person say? They advise having a script. Picking that time, having it be a safe environment, a nice, pleasant time, and almost having a script. So you're not just going, let me tell you, Mom, something's wrong. Have a little script laid out. And then offer to go to the doctor with that person as support. And sometimes multiple conversations are needed. Maybe the first one wasn't enough. And then finally reaching out for support. Of course, the Alzheimer's Association is phenomenal. You're not alone going through this process. reach out to the Alzheimer's Association. See a doctor. What kind of doctor? Well, most people start out with a primary care, and they may refer you to a number of different doctors. My mother ended up finally going to a neurologist who was able to pinpoint exactly what she had. That it might be, several steps before the diagnosis is made. Okay, why isn't this, okay, here we go. Okay, my little clicker button is not working. Okay, let's see if it's, there we go. Okay, early detection. Again, we're going to talk about why that, it's kind of coming in a little bit, but we're going to talk about why.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Okay, so early detection, it's not a good thing to be in denial. Early detection is important. It's really very vital. So we're about ready to wrap it up. Seeking a diagnosis, test your knowledge. Little question here. There is currently no way to diagnose Alzheimer's disease. True or false? If you answered false, you're right. They can now, there is the technology to diagnose Alzheimer's. There's a lot of different tests that are available. And before, it had to be done through an autopsy a long time ago. But now we can do this. We can find out what the issue is. So here they are. What's going on with the Garcia family? Appointments have been going well. Mom is handling them okay. Think it's really dementia? No, I know what that feels like. I guess we won't know until we get the diagnosis, but let's ask Dr. Salloway. Could it possibly be something else?
One could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
Got to rule out any other possibility, that's for sure. All right, so what's next? What happens now? I called, got your voicemail, how'd it go? Call you later when I get home, but the diagnosis is early stage Alzheimer's. Oh no, what do we do now? Their Alzheimer's Association is there as a resource, and I wish I had had that when I was taking care of my mother. Okay, the Alzheimer's Association. I just want to real briefly. These are just really powerful testimonials.
I've had a couple of phone calls that I've been able to make in to the call center. When I've had a couple of quick questions that I wanted to ask, you know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
I remember crying at 2 a.m, not knowing what to do sometimes with my mother. And I wish I had been able to talk to somebody to support me. But they're there now. So we want to make sure that everybody knows about this, because the truth is, if you have a brain, either you are at risk of dementia, your husband, your wife, your mom, your dad, you know, if you got a brain, you're at risk. So this is an important organization to be aware of. All right, and you know, I'm going to get going because we have a great presenter to come and talk about hearing loss and so forth. But please think about volunteering, like what I do. Oh, it's fabulous. Makes me feel so good to be of service. You can be involved in advocacy. Trial match, you can get involved in different studies around the country, and then there's fundraisers, the Walk to End Alzheimer's, and others. So by all means, you know, get involved if you can. And I think that's it.
We do have Jessica Peterson, Dr. Jessica Peterson, on the line as a special guest for us. We don't always have audiologists and other specialists, so it's great to have her here.
I'm Dr. Jessica Peterson. I'm based in Broomfield, Colorado. My background is after grad school, getting my doctorate degree. I worked with my youngest patient I think I had in those 6 years clinically was 2 days old, all the way up to someone who was 106 years old. So I've seen that full gamut. I worked clinically for 6 years, and now I work with a school district in the Denver metro area managing hearing health education for about 80,000 students. So I am very passionate about hearing healthcare and hearing health. I love everything about it and the environment that I get to work in. This past year, one of the silver linings for COVID with me was I really don't sit still well. And I started to think about my experience clinically working with adults and what I see that we provide our students who have hearing loss in our school district. And I decided to create a company to bring hearing health care education to older adults. So that is at www.audiologyconsults.com, and it's courses that I've recorded so that adults can learn communication strategies, learn about their hearing health, and little tidbits about hearing aid advice, really ways and strategies to manage your hearing loss outside of the clinic, because we know that those doctor's appointments can move quickly. It's a lot of information, and so I wanted that information to be more readily available for people. Today, what I'm just going to talk through a little bit is just the importance of hearing health. I think hearing care is something that is so important, but often I feel like what ends up happening is we kind of forget about it. We say, you know, it's easier to deal with that later because I have more important things to do. And so I see a lot of adults put that hearing healthcare off, but if we manage it early, a lot like early diagnosis of Alzheimer's, dementia, our care can go so much better and our outcomes can be so much better. So the first thing we're going to talk about is how often does hearing loss occur? Do most people have it? Do just a few people have it? What is the likeliness of that? And are you guys able to see my screen? I believe it's shared.
Yes.
Perfect. Thank you. Just double checking before I jump into everything. I pulled this off of the NIH website, but 1/3 of people in the United States between 65 and 74 have a hearing loss. When you hit the age of 75, you have 1/2 of older adults have hearing loss. So you have a 50% chance of having hearing loss. It's something that we need to monitor. It can be really subtle when it first begins, but again, early diagnosis of hearing loss is key to having good management of it and successful outcomes. And again, it's not something you really want to wait on, because communication really is what makes life rich. It's how we connect with each other. And if you are starting to struggle with that piece, what we see is there are a lot of pieces that can also create behaviors with Alzheimer's dementia and make some of those behavioral issues that we see there even worse. Ooh, it's not going to let me click. There we go. Okay, so the most common type of hearing loss that adults have is called a sensory neural hearing loss. This type of hearing loss, the damage occurs in the cochlear nerve. So it's the nerve that runs from the ear to the brain, specifically the cochlea. There are little things called hair cells. And again, this typically occurs with aging and noise damage. Noise damage is tricky because it occurs across the lifespan. So just because in your 60s and 70s you didn't go to concerts, if you did when you were 18, 19, 20, that loud noise exposure early on can actually affect your ears even when you're older. Unfortunately, there is no cure for sensory neural hearing loss. It's typically permanent, and it may get worse over time, which is why monitoring is important, but it typically does not get better. And there are a few different possible causes. Again, aging is the most typical one, but an audiologist and ear, nose, and throat doctor can help parse out if there are any other underlying causes besides aging and noise exposure. So this picture here, this is called an audiogram. So this is how an audiologist communicates where hearing loss occurs. And what I've put on here is someone who has a mild hearing loss. The gray area at the top of this graph, what I would ideally like to see is that all the circles, the red circles for the right ear and the blue X's for the left ear, would all be up at the gray top area in the normal zone. However, this person, you can see their blue X's and red circles, they kind of fall into that yellow mild area. So this would be a mild sensory neural hearing loss. And I don't want you to get too stuck on understanding the graph, but I think the important thing here is I've circled some letters, P, H, G, K, F, S, and TH. So about half of the consonants in the English language. One of the biggest things that I see people do is they say, well, it's a mild hearing loss, I can wait. I don't need to do anything about it. I don't need to treat it. I'm gonna wait until I feel like it's really a lot worse. And what you can see is that you're missing a lot of sounds, even in that mild zone. So the word mild, I think, is a little bit of a misnomer, because a mild hearing loss can have a huge impact. And we're gonna look at some signs of hearing loss here. And these signs start when we're in this mild zone for hearing loss. So one of the first signs is that someone has started to say what a lot or ask more frequently for repetition. There are definitely times when we all ask for repetition. If we're in a restaurant and background noise and we're sitting farther away, if maybe we're not totally paying attention, we're thinking of two things at once and you catch part of the phrase. But I think an increase again in that what can be a really key piece of saying, ooh, I'm really struggling. And even when they repeat, I'm having to lean in and really watch their speech to understand. Another sign is misunderstanding or answering and responding to conversations inappropriately. So someone asks you about the weather and you say, it's Monday. Okay, did we misunderstand what was going on? Or did we understand the question? And I like to point this one out because with Alzheimer's dementia, what we worry about is someone not understanding, but if they also have a hearing loss, did they not understand what was asked? Or are we seeing another sign of Alzheimer's dementia? And again, that behavior can really change. They may have part of it from Alzheimer's dementia, but again, we have to make sure we're treating both at once. You can't pick and choose the health conditions you want to support. The other one is becoming more socially isolated and seems exhausted by conversation. Again, I think this just blurs those lines even more with Alzheimer's dementia, that social isolation. Do you not want to go out because you really are getting confused when you're out? Or is it so exhausting to be in those social situations and try and understand and try and communicate that you struggle more and more? Number 4 is my favorite for men mostly, because I had older men come in all the time and say, my wife mumbles. If she would just speak clearly, I would not have a problem. And often what we see happening is you're losing those higher frequencies, kind of in that mild hearing loss that I showed you. Those speech sounds in those high frequencies, they give us clarity to speech. And when you can hear that the speech is loud enough but not clear, it just sounds like people are mumbling. And so that is a very great thing to look for early hearing loss. Early mild hearing loss is mumbling or not speaking clearly. It may not be the speakers, it really may be your ears. Another one that people say is just increasing devices volume. So maybe you flip on the TV and your significant other or your friend was just watching it, and wow, it's loud. It's just a little loud. So seeing are those devices increasing in volume? And then the final one, this again goes with that early mild hearing loss. We see understanding and background noise is more difficult. Background noise can be difficult for everyone, but I think, again, look at your baseline. And if it's constantly seeming like it's harder and harder to carry a conversation when there's background noise going on, it is definitely time to get your hearing checked and figure out what is happening. So some concerns that really, again, overlap with Alzheimer's dementia and hearing loss, and just in hearing loss by itself, are, again, that increased social isolation. We don't want to stack issues. So if we're going to see some behavior changes, maybe from Alzheimer's dementia, we don't want the hearing loss to also create more of a behavior change. So hearing loss, the increased social isolation really gets into, it becomes so much more difficult to hear in situations that people start to feel exhausted by it. We're going to talk a little bit more about auditory fatigue in a minute. But your brain does have to work harder when you have hearing loss to fill in the blanks of what you're not hearing. And so we see people start to really struggle in those situations and to not want to do them anymore. So they may have loved getting together with the whole family, but now they really only want to get together one-on-one. Or they used to go to the store and have some self-advocacy skills there, going and doing things on their own, but it's just too hard to talk to the cashier. And so I'm going to do order pickup. I'm not going to have those social interactions. Difficulty communicating and following instructions. So I had several patients who struggle with Alzheimer's dementia, and sometimes what we would see is their caretaker would come to me and say, we're just really struggling. Like, I give the instruction and then it's almost like they try to do it, but they don't quite do what I asked, or they were following directions really well and they weren't. And when we retested hearing, what we saw is there was a change. And so they were maybe that memory problem. Is it a memory problem, or is it a hearing problem? And that's something that you can sometimes parse out. And by giving that extra hearing support, that communication, we know at least there's a clear signal to listen to. And that becomes really key to making sure that they at least have the information, and then we can see how that can be managed. And that can very well sometimes help with those behavior problems. And then finally, just environmental awareness. We need 2 ears that are hearing well to know what direction is a car coming from, localizing sounds. We need to be able to hear if there's a fire alarm or the phone ringing or the blinker on your car. If you're driving down the road with that on, my joke is I should leave my card on those cars because that's time for a hearing test. So just all these alerts that, we live in this auditory world and we need to be aware of these sounds to be able to function and communicate, interact with the world around us. So what is that process? What should a hearing loss treatment process look like? I encourage anyone who, like, maybe you've just had this conversation with your mom that Anne Maria was talking about, of this difficult conversation, you know, I'm noticing some memory changes. I love it when primary care, when you bring that up and they say, well, let's start on these pieces, but let's also get a hearing test. I think that should be one of the first steps that we do along with it, because again, we want to make sure, are our ears healthy? Are we able to hear and communicate with people around us? At that hearing test, the audiologist will review those hearing test results typically. And then there's a next appointment where, if they've recommended any technology, that you would discuss what technology is most beneficial and possibly order something. And then a third appointment is where you're typically fit and do some follow-up adjustments. And then routine hearing aid care and follow-up, if you are wearing hearing aids, is typically at least twice a year and at least yearly for a hearing test to see if there are changes. So that's kind of just best practice standard of care. Again, one of the reasons I created my courses is I feel like, just in this talk, you can see there's a lot of hearing information. There's communication strategies, there's understanding your hearing loss, there's tips and tricks for understanding hearing aids, there's types of hearing aids to choose from. There's a lot of foundational knowledge that when you are in a 30-minute appointment and an audiologist is talking at you, that you have to absorb. And so those recorded courses, I do think, are very helpful for patients to really have foundational knowledge to understand this process and how they can create their best communication plan possible. So that auditory fatigue, I love to talk about that along with Alzheimer's dementia, because auditory fatigue is kind of your brain's capacity, your brain's power pack to process auditory information. With a hearing loss, and even in children in a school district, what we see is with background noise and with a hearing loss, auditory information, it's harder and harder to process the more fatigue you have. And when you have a hearing loss, you fatigue faster. So maybe you have seen in your parent or your loved one that in the morning, it seems like information goes in really easily, and by the evening, they're really struggling to process information and to understand it. That is a very real phenomenon, whether or not you're treating hearing loss. And so I think always being mindful of fatigue can really help you know, like, what is best for them. So maybe you're noticing you're going to go out to dinner, but they're really fatigued, and just talking to them that day can be difficult. By the evening, it might not be the best day to go into background noise where it's a harder listening environment. Might be better to postpone that, maybe go to brunch the next day instead, something like that. So this is just something to be mindful of. Hearing aids are a complicated process. They are not, hearing loss is not really linear. There are devices to help, those hearing aids help, but they don't fully restore your hearing. And so remembering that it's a hearing loss plan. Again, even with hearing aids, you need communication strategies. You need to understand that in a restaurant, what can I do to help myself hear better? In a group situation, are there things that I can do? Asking for people to repeat themselves is still common, even with hearing aids. Again, this hearing aid, it's an aid, it's not a cure. And so I think making that plan with the people that you communicate the most with, and knowing how to advocate for your own hearing needs, is crucially important to success and to keeping communication open with your friends and family. And again, this is just where my site is. If you'd like to learn more, my longer course is everything about hearing loss. And I do have one that caregivers have found more helpful. It's specifically for caregivers, just talking about how to help a loved one or a patient with hearing loss. And those coupon codes didn't go in, but there is on my website, ask any questions. And if you would like a discount off a course because you attended here today, go ahead and send me a message. I am the company right now. So any message you send through there goes to my email. So you'll be in direct contact with me through my site, filling out that information. Or if I love connecting with people, and that's why I do come to these talks. I think hearing healthcare is, again, just crucially important. So I've got a frog in my throat, but I really would love to connect. And if you have any questions at all, I think hearing healthcare can sometimes be convoluted, and it can be difficult to know where to go. It can be difficult to know what kind of care to expect. Any of those things, I'm more than happy to answer questions for you all. All right, and I'm gonna go ahead. I will stop. Oh, and those are the couple studies that I did quote there. All right, I'll turn it back over. In questions, again, chat, or you guys can ask them directly to me if there's something that came to your mind.
Jessica, I do have a question. I've noticed because I'm going to do everything I can to absolutely lower my risk of dementia. As soon as I found out I had hearing loss, which was kind of an accidental discovery, I said, that's it. I'm going to get hearing aids. But so many people, my uncle who just passed, and my mother-in-law, they have hearing loss. They both have hearing aids and they won't wear them. What's, I mean, I don't understand that. What do we say to encourage them?
Yeah, I think it's a common problem. And again, this is one of the holes that I felt like, I was like, oh, we need to figure this out as a society. Because I think the expectation when you go to get hearing aids is that you put them on your ears and yay, like the world is great. Our brains actually change when we start to get hearing loss. And so what we see is that as soon as a mild hearing loss occurs, even 6, 7, 8 months later, there are small changes in our brain, and our brain habituates to hearing with hearing loss. We don't think it's quiet, we think it's normal. So all of a sudden, when you've gotten this hearing loss that over time has just gradually gotten worse, and then you walk into an audiologist's office, you put hearing aids on, and wow, all that sound comes in again. It's almost like a surprise to your brain, and it has to readjust. The research studies that I've read that talk about adjustment show 6 to 9 months to fully adjust to hearing aids, and that's if you're wearing them all waking hours. So it's not a quick process to readjust. And again, I think it's understanding that it's a process, and that it's not just the hearing aids, it's communication strategies, it's talking to people around you and advocating, letting them know, hey, I have a hearing loss, you might have to repeat for me. Oh, can you say, I didn't understand that, can you say it a different way? You might have to write something down. With masks right now, with COVID, not being able to watch people's lips, we do a lot of our speech understanding watching people's lips and understanding them that way. So, asking someone who works with you frequently for a clear mask, things like that. Yeah, Barbara.
You're muted.
Hi. All of the hearing loss experiences you've described so far, I've lived with for over 40 years. So I've had a genetic hearing loss, that a propensity to have the loss, and then I got the loss. So I now use, for all those years, I've used a hearing aid, and now I've lost all the hearing in one ear, and I am a new cochlear implant user on one side. So here's my question though. In the I'm also have Alzheimer's, have a grandmother and a mother who have died the long, tortuous, undesired death of Alzheimer's. So I'm very sensitive to all of that and keep myself informed. In the literature, I thought I was seeing that there was a connection, not just the one I feel like I'm hearing from you, of the added dimension of having hearing loss while going through dementia, but that there's actually another type of connection between a hearing loss and dementia or Alzheimer's. And I guess that's part of what I thought I was going to be listening to, and if I did, I didn't make the connection. Is there a connection between hearing loss and dementia per se?
Yeah, let's I'm gonna pull up a slide really quick because I'm not sure why. I think my clicker was being funny, because that's a great question that I get all the time. Can you guys see this slide now?
Mhm.
Yeah.
So
Slide?
I'm sorry, what?
I'm sorry, did you show that slide already?
I just no, you know what? It was in my slideshow, and I just had the thought as you were talking. I think I was having some issues with my mouse, and this did not pull up. I think it jumped between two slides.
Okay, I was getting afraid I had dementia there. Oh,
nope. I think it jumped through here. So there's no true. They can't say hearing loss causes dementia or dementia causes hearing loss. There's no link. But this study was even 10 years ago. It was published in 2011. And what we do see is that people with a mild hearing loss are twice as likely to develop dementia.
great.
If you get a moderate hearing loss, that triples your chance of developing dementia. And if you're if you have a severe or profound hearing loss, that makes you 5 times more likely to develop dementia. What they also saw too is this is untreated hearing loss.
Oh,
Again, that early intervention, like Barbara, what you're doing, you knew you had this genetic predisposition to develop a hearing loss. You've gone through that hearing aid process, and congratulations. I worked with implant patients for 5 years mapping them, and I know it's a big change to get one of those cochlear implants. So congratulations on that process.
yeah, I can't say that's very fun, but yes.
It will get better.
I'm
It will
glad
get better.
out there, but.
Yeah. How far are you out from your first map?
Okay, just a minute. Let me see your, okay, we don't have your face right now. Would you ask the question again, please?
Mm-hmm.
How far?
How long have you had your implant?
Just 9 months. And of course, it's been during COVID, so it's been great fun, as you've alluded to have the mask. I've certainly, as the literature, any of your attendees who've read about it or have any familiarity, you know that the sound that you get from it, for most people, is like a Minnie Mouse or helium balloon sound. So it's not great to have a version of normal hearing coming through your hearing aid and then have electronic synthesizer coming through another side of you and having, so I'm at the point where I can now accept it. Before, it was just so jarring. But where if I really want to hear, like now, I don't wear it because it competes with the closer to normal sound. But now what I do is, what's been interesting so far is how much, and you mentioned safety, and that is a big concern. I can't hear the faucet that I've left on with just my hearing aid. I don't hear, pleasantly, I don't hear the motor to the refrigerator. I don't hear the ice maker drop the ice down. With the cochlear implant, I hear all of that, some of which is not welcome. Who wants to hear your refrigerator motor louder? Not me. But I'll tell you what I can hear that I couldn't hear with my hearing aid, and it's pretty fun, is my cat. I couldn't hear the licking. I couldn't hear the sound of him licking himself or licking my hand. I couldn't hear the sound of crunching on his food, and now I can. And so that's a fun thing.
Yeah, and I think you bring up this great point of, you have a cochlear implant is a treatment for typically a severe to profound hearing loss. So again, we're looking at that mild hearing loss on that graph, but that hearing would be much, much worse. But again, this brain learning and this brain adjustment, the longer we miss out on sound, the longer it takes for our brain to adjust to that sound that it's given back. So Barbara's hearing all of these new sounds that are we've learned to ignore. Like if I have normal hearing and the ice maker goes, my brain doesn't alert to it because it knows what it is. But if they're novel, if they're new, it takes time. And Anne-Marie, to kind of bring it round to your initial question of why do so many people struggle with that hearing aid use? It's typically adjusting to all of these sounds that our brain now thinks are novel, and we have to relearn to ignore those background pieces. The more you wear your technology, the better that typically gets. But it is a process, and it is not a 2-week process. It's not a 3-week process. It is typically months or possibly years. The more consistently you wear it, the better it gets.
I would like to reinforce something that you said, though, for the listeners, is the part about the longer, for other categories of hearing loss, such as may come with aging, the longer one does wait, the harder it is. And I got to watch that with my mother, who gifted me with the genetic possibility of hearing loss, and in fact had the hearing loss, who would not wear a hearing aid. Of course, her husband said, let's see, she said he mumbled, but of course she mumbled. But she wouldn't wear a hearing aid because it would make her look old. So there's so many reasons one will use since I developed it in my 30s, it didn't make me look old, and I didn't feel old, and I was fine with it in a professional setting and everything. But older people, I've run into a number now that I'm older who are avoiding hearing aids and need them, but it's going to hurt. It is going to hurt when suddenly that motor is coming in both your ears and you've done no practice. So I'd really reinforce what you just, one of those points about not putting it off.
Yeah, it really is so important. And I do think in society we have this stigma that hearing aids are for older adults. But again, like right now, my real job is managing a school district with 80,000 kids, and I have a preschool program where all my kids have hearing loss in that program. About 5% of little kids have hearing loss, and wear hearing aids or cochlear implants, other technology. And again, the earlier we manage that, one interesting study from infants that I think does apply to adults too is if we diagnose hearing loss and fit children by 6 months of age, if they're born with it, they, with early intervention, are typically ahead of their matched age normal hearing peers when they enter preschool. So that's, it just shows that, you know, with these pieces of good hearing healthcare, we can really do a lot of work to support ourselves and support our communication goals rather than waiting, putting it off, and then really it just gets harder. It's one of those things. Your ears need that sound. It's like exercise for your auditory cortex, the part of your brain that hears, and without it, it gets lazy, and it is hard to go from, you know, no walking at all, laying on a couch, to a marathon of hearing if we just turn it all back on. So
yeah, I think that the people, you know, I started when I was 62 to wear these, and you know, I had to swallow my pride a little bit because I feel very young, and I'm told that I'm kind of youthful and and then all of a sudden I've got these hearing aids. As subtle as they are, they're obvious, you know, they're there. You see the little wire or the little thing, you know. So it really is a question of swallowing your pride. Here I am, someone that's, you know, feeling so young, and I'm wearing hearing aids. So I think that's big problem, Barbara. I think you're right that it's, you know, the older people don't want to wear them, and you know, the nice thing about it, like I had to turn down the volume on my hearing aid. I love it. I just go to my phone and I adjust it, you know, and it's great. And I'm going to get some new hearing aids, and they're actually going to be Bluetooth connected. So I'll be able to just, you know, turn on my music instead of having to get, you know, my earphones for my music. I'll just, you know, put it on my phone. They've also have something with the televisions where, you know, there's extra things you can do with it. Like, I can't describe what it is, but basically, you know, you're going to get enhancement through that. So it's there's some benefits to just go ahead, bite the bullet and do it.
Mhm.
And I see a couple of questions in the chat too. I'm just going to read them. Gloria, it looks like you have a mild hearing loss and you've been to an audiologist. How early is early? I know this is a lifelong slope. So you're delaying the process. And you hear that there are so many problems. You would like to get started and you do appreciate to not hear the sounds of the noisy refrigerator. When do you get concerned, and is this totally subjective? I think that audiologists can typically make a recommendation of if you are I used to tell patients, yeah, I would wait, let's check you again in 6 months or a year. You're in a gray area. If you feel like you're struggling to communicate, let's try something. If you feel like you're doing okay, let's check back. Or yeah, let's talk about some hearing aids. And I think the tricky part about that is it just depends on what audiologist you're seeing and how comfortable you are talking to them and managing that care with them. But most of the time, audiologists will provide that kind of recommendation of when they think it is best to get hearing aids. But again, that does depend on the practice that you're seeing. I don't think it's subjective because, like you saw in that mild hearing loss, those sounds that you're missing up there, they can be pretty apparent. It might not be noticeable to you, but again, it's been a gradual process. I think that once a lot of those high frequencies, so 2000 hertz and above, if you look at 2000 to 8000 hertz on that audiogram, the higher frequencies, if all of those are outside the normal range, that was more of my cutoff for, I would say, yep, it's time to get hearing aids on you. Does that answer that question, Gloria? You can type in the chat if there are more questions, or if we need to chat further too, it's lots of questions, you can always email me off of my website there. And Teresa did say, yeah, there are many fashionable hearing aids now and some look like you're wearing ear pods. And yes, I absolutely agree. They do.
Barbara, did you have a question as well?
Are you talking to me?
Yeah.
Yeah. I was thinking, that they told me I had a mild to moderate hearing loss and I had the testing done. So I hear, but with this COVID and everything, I don't know about hearing losses or hearing aids. They're expensive. I don't know if they're covered under Medicare. I mean, I hear sometimes things are too loud, but I don't know. I'm worried because I'm 75 and now, like she says, I can hear and I can get into conversation, but sometimes on the phone, I got the caption phone. Sometimes I can't hear my granddaughter, people talk low. I don't know if that's a concern. So that's what I wanted to ask.
Yeah, I would say, again, I would revisit with your audiologist that you've been working with to get their full recommendations, and they can often check your insurance. I used to work with patients who were concerned with costs about finding funding. I'm in Colorado, so it depends on what state you're in, but there are often grants. I live near Boulder, and there's a gerontological society that would often fund hearing aids for patients if they fell into certain price ranges. So I think finding resources can be something an audiologist can help you with in making sure that you're able to get that care, because it is so important and it is frustrating under Medicare federal level. One of the things that they've said is that hearing aids are they're optional care basically, and so they're not deemed as medically necessary, which is why insurance companies are not obligated to cover them. Even for pediatrics, for a long time, they weren't covered. We had a state law passed in 2007 that mandated hearing aid coverage for minors under 18. And that, even in our state, was a big lift to get that taken care of. So you can imagine a baby who can't hear and has no language. We have to get hearing aids on them, but that cost for parents used to be even huge. So I think it is advocating for that change within local and other government pieces, that then, the more people that speak up about that need, that will happen. But that is definitely a problem. And I do sympathize with that.
Yeah, I don't really have I've gone to a couple of ear doctors, but I have to find somebody that I feel comfortable with, and maybe get a test done again and find out. But thank you very much for your help. I appreciate it.
And when you're looking for someone, what I always recommend is there are a lot of places that are nonprofits that fit hearing aids. That's what I used to work for as an audiologist when I was fitting hearing aids. And so then they are not working on commission or looking at their sales numbers. They're there to provide hearing healthcare. And so like typically we have like University of Colorado Health here. That's like a nonprofit hospital, and they have audiology there. So I would look for hearing health centers that are located within hospital systems that are nonprofit, because they are often more willing to help you and make sure that you find funding that you need.
Okay. Thank you. Because I'm in New York. I'm in New York City, nonprofit.
Wow. Yeah. There's a great, I actually went to a conference in New York 4 or 5 years ago. Let me think about it for a minute, but they have a really good audiology program there.
Okay. Thank you very much.
Yeah. I like their audiologists were excellent.
We have another question in the chat. It says, do you have a recommendation for TV for someone with hearing loss, does not having hearing aids, and lives with someone else?
Yeah, so if you're not going to do that hearing aid piece, one thing you can do is there are TV ears, and they come either in headphone form or they kind of sit like this and they hang down. There's a little volume here. They connect to the back of the TV, and then that person with hearing loss can turn the TV up to what they need. The other person can listen comfortably. So that
Are
is
they
definitely
expensive?
less than $200 typically. So not hearing aid expensive. And I've had patients who just absolutely love that. Even patients with hearing aids who love the TV ears, because they could give their ears a break from the hearing aids that night and turn up the TV to what they wanted.
Wow, that's great. It's called hearing ear?
TV ears.
TV ear.
I think Best Buy has them, all sorts of places like that.
Wow.
And Gloria, just to finish your question, NYU Langone Health.
Oh, okay.
It's I wish I remember quite where it was. Kind of, I feel like east of Times Square. Langone Medical Center. Does that sound familiar?
Yeah. Yes, it does.
Yeah.
Okay. Thank you.
I want to thank everybody for joining us today. It's always a pleasure to share what we know with others, and we're all on the same page in terms of trying to stay healthy mentally and physically. So yeah, if there's nothing else, I guess, Kayleen,
We'll wrap it up. Thanks everybody. Enjoy
Thank
the rest
you.
of your day.